Welcome back. In the southwest, the federal government is being challenged to fund the creation of seismic stations to monitor natural geological occurrences. A geologist at the University of Ibadan in Oyo State, Professor Gbenga Okunla, believes the country will benefit from these seismographic stations, which can serve as early warning systems for earth tremors, vibrations, and quakes.
You have a situation where, especially towards the end of the rainy season, where you have persistent rains, you have the rocks will have been heated up seriously during the day. And of course, you have within these rocks small fractures that are also deep-seated 300 meters, 400 meters, microfractures that go deep down. So when these rains are persistent, they percolate these patterns, these fractures, and it's like you pour a cold water. It's like you pour a cold water on ice water on a hot rock. So it sets up a lot of splatterings and vibrations, which go into the fractures and then begins to cause some local vibrations. And you can see that the vibrations are localized. I want to say that it's not only around Koi, Kafanchan that you have them in the country. It's the same thing that happened, around Ishen here. So they are essentially localized. Phenomenon also happened in 1993. It happened in 1996. It happened in about 3 places around that area: Kubacha, Kafanchan, and this Koi area, and we documented it. And I want to just appeal to people that they should not panic. Even if you still have it on 1 or 2 more occasions before the end of a raining season, it's going to be essentially local.
To the health sector, immunization of children in Nigeria is being adversely affected by lack of accurate data for planning. That's according to the National Primary Healthcare Development Agency. Now, the agency's head of routine immunization, Mr. Basi Opasin, at a forum in Abuja, says the lack of such data affects planning for vaccines for immunization exercises, especially in remote areas. Inadequate funding, lack of clear-cut policy, as well as over-concentration of secondary and tertiary healthcare have been identified as challenges facing primary healthcare delivery systems in the country. That's the concession of participants at a workshop for senior civil servants on strategies and approaches for effective health sector budgeting going on at the National Institute for Policy and Strategic Studies, Kuru, in Plateau State. Over 50 participants, comprising of senior civil servants in the public sector, drawn from the federal and states as well as private organized sector with direct responsibility for priority setting and budgeting for health sectors, attended the workshop.
We don't have enough resources in all our countries. And also, very importantly, you need to catch a lot of these things early. You shouldn't wait when they need specialist care in a big hospital. So if you do primary health care where you are in the community, the people are coming to clinic very early and things like that. It saves less money. It's better for the patient to be seen early than to wait for secondary care. It's a resource thing. There are some diseases that you can't help, cancers and things. They come, you need to be treated.
Now there's a policy of the federal government called the primary health care under one roof. And that policy seeks to bring in all the human resources, all the financing, and all the policies together, and the monitoring and evaluation under one framework. There are 11 pillars to that, and all the states, this has been adopted by ratified by the National Council on Health, and all the states have been urged to rapidly implement it and back it up with law, establishing a state primary health care development board or agency, as they choose to call it, and backing it up with a law that is enacted, so that it's not something that can be reversed.
Finally, the House of Representatives Committee on Navy says the Nigerian Navy is in need of more support to effectively tackle the 21st century challenges in the nation's maritime domain. Addressing pressmen shortly after a facility tour of some platforms at the Eastern Naval Command in Calabar, the Cross River State capital, the chairman of the committee, Honorable Abdul Samad Dasuki, assured the Navy of effective representation in the 2017 budget. Honorable Dasuki said most of the platforms inspected are dilapidated and cannot function maximally in its quest to safeguard the waterways.
It's an unfortunate situation whereby the Nigerian Navy is securing the maritime domain and doesn't have enough capability and capacity. Yes, they have it in the men, but the efforts being put in to make sure that they sustain that is not there. And as the Committee on the Navy and the House of Reps, which we are going to make a case for the Nigerian Navy, is they need to be more empowered. I'm sure you've seen for yourself the jetties here, which in the first place, they shouldn't be there for now. We need to upgrade them to meet the 21st century challenges. And apart from that, we are looking at the ships, the gunboats. I think there's the need to even possibly overhaul them, get the modern boats. Lucky enough, here in Nigeria, we have seen local gunboats being manufactured. So we're going to keep encouraging them.
With the ongoing effort, and as we have seen or heard from the House Committee, everybody is working hard to see that we can tackle these challenges together. The Navy alone cannot do it. It's for all of us to put all our acts together and get it done.
And that's where we call it a day for this edition of News Across Nigeria, where north, south, east, and west, we tell you what's happening across the country. I'm Olumide Macaulay. From all of us here, thanks for watching, and see you again.